This
the
conference will now be recorded.
In the Medicare Medicaid Assistance Program for the area of Agency on Aging. So I'm not going to speak much here because there's a lot of ground to cover, but I think this is going to be very helpful for everybody, not only for those individuals who have Medicare, but also for the individuals who are taking care of people with Medicare, or people who are probably going to be starting Medicare in soon. And Vickie's going to teach us about the tips and tricks to make sure that we are getting the most out of the coverages that we have. So thank you, Vickie. And I'll let Vickie also give more introduction about. Thank you so much.
Good afternoon, everybody. As you can see, I'm here because of the Area Agency on Aging. That's something that's available to the country based on national grants. That's how we exist. MAP is a subset of that agency. It's one of the specialty areas, specialized focus, and we are mostly staffed by volunteers. There's hundreds of us within the state of Michigan, and I'm one of those, and that's why I'm here today, is to help you. I originally joined this twice, and the reason is my background is that I've been director of benefits for a couple of, well, 7, over 42 years, major companies in Michigan. And when I retired, I realized that there was a wealth of knowledge that I would continue to share. And I'm one of those people, probably like many of you, that believes in serving others and helping. So it seemed like a good fit. So with that, I want to let you know that I am joined today by another member here in Dr. Calado's staff. Her name is Bernadette. She's kind of new, but she's very technically savvy. And she's going to be my emotional tech support today. So I'm very thankful for that. My goal is that we will not be talking about my topic for 2 hours. We will have Q&A towards the end, and I'm suspecting that you'd all like to hear a few words from Dr. Calado too. I'm sure there's current information, et cetera. So don't worry, I'm not going to take the full 2 hours. In full disclosure, I have a tendency to wander. So if I pause, I'm getting myself back on track. So with that, we're going to begin. Okay, just push the next to the right. To the right. It's not happening. Here we go. Yeah. No. Okay. Here we go. So the next slide is kind of just a quick beginning commercial. You may or may not have heard this yet. This is kind of a news flash. It's hot off the presses as of last Monday is some of it. The premium for Part B, you're used to hearing $144.50. It's going to go up to $148.50. That's great news because last year it increased from $135 to $144. The deductible under Part B that we all pay, most of us all pay each year, is going up a mere $5 from $198 to $203. This next row is something that's probably not everyone is affected by. If you have a higher income, those people are contributing more to the Medicare system out of the kindness of their hearts. As part of Obamacare or AHA, they pay an additional amount over and above. And so the benchmark for that is if you are a single person and your income is showing over 88K, those numbers have been adjusted. And if you're married over 176K, those numbers have also been adjusted. You probably have heard by now, excuse me, and I'm not going to go into that detail, but we do have the information. So if anybody needs it, talk separately. On the bottom, you have probably heard by now that Social Security benefits will be increased in January by 1.3%. That's always tied into a COLA number, and that was announced previously. So my focus today is twofold. One, I want to talk for a moment about all those Medicare Advantage ads. They have a tendency to drive some of us counselors nuts. We get a lot of questions. They sound great. but there's a little bit more to the story. So that's one. And number two, a lot of you will ask, I just went through a review of my meds last year. I'm okay with the plan. Do I really need to do it again? And will be showing you why and how to go about that. So with that as background, let's start. We'll take this in this series. We'll start with a quick review of the Medicare plans. We kind of need to have a baseline so we're all on the same page. I mentioned we'll talk about the Medicare Advantage plans, i.e. those ads. We'll talk about why it's imperative to do the annual review. My goal today is to spend a lot of time in a demo mode with you on something called My Medicare Account. You'll be pretty surprised to see how much of your information is available to you. We counselors never go anywhere without talking about fraud in Medicare before we leave. This is so critical. We, you, I, everyone is key to finding the problems in this area. And then lastly, we'll have a Q&A. So we'll start here. Medicare now consists of 4 parts. We refer to the part A, B, C, and D. And the little icons will help give you a hint. Part A is hospital insurance. And what this means is if you are in the hospital, in a bed, you are admitted, and that can be to a hospital, to skilled nursing care, or hospice, your Part A coverage comes into play. Part B is the medical insurance for pretty much everything else, except for RX now. But that's going to cover things like doctor's visits, lab work, x-rays, emergency room, outpatient hospital services, etc. And then we move on to Part C. What's interesting to know that when in Michigan we have 32 HMOs and 22 PPOs. So we have a total of 54 options that people can avail themselves of. Part D in Michigan, we now have 29 plans. So let's talk about each of these in terms of premium. No. Looks like I went 2 slides. This is the one I expected to get, and I got this. So it should just be back 1 slide. There we go. Thank you. Sorry. Quick break. So as you can see, we're now on the premium slide. For Part A, for just about everyone, that is free. And what that's based on is if you have contributed to FICA/Social Security for 10 years during your career, your working career, then that Part A will be free to you. Part B is something that you pay for, and everyone pays for. It's we just talked about the new number is $148.50. Part C, an Advantage plan, those premiums are all over the marketplace. They can be $0, and they can go as high as $299. Part D, prescription plan, of those 29 plans I mentioned, their premiums range this year from $6.90 to $109.30. And if it doesn't pop out to you, that $6.90 is some really great news. So we'll talk about that also again later. So now with all of these plans, they all have deductibles and copays. So I'm going to move along there to the deductibles and coinsurance or copays. I'm using that interchangeably. Copays refers to a flat dollar amount. Coinsurance is a percentage. It doesn't matter. There's some form of cost sharing. So within Part A, and people are usually surprised by this, if you are admitted into the hospital, there is with Part A a $1,484 deductible. And if you stay longer, and it's quite a bit longer, for instance, 60 days if you're in hospital or 20 days in a skilled nursing facility, then there are some additional daily copays that come up on top of that. Part B, all those other things are subject to a $203 deductible per year, and then you have a 20% coinsurance. Part C has a variety of copays, and it depends on the service. For instance, if you see an office visit, there may be a 0 copay. If you see a specialist, it may be $45. If you need some extensive x-ray work done, it might be $200. Usually the last one's an extreme example, so I don't want you to think they're that high. And then with Part D, there's a deductible that can be up to $445. And then from there, the cost sharing varies based on a myriad of factors that we're going to talk about. So, catch up here. One of the things is you will hear us speak of gap or supplemental plans. And let me, there we go. Oh, now I got 2. Okay, I got 3. One more. Okay. You notice some areas that I've turned to yellow print right now, the deductible under Part H and the coinsurance under Part B. When we talk about a gap or a supplemental plan, and what I'd like to do, does my mouse work here?
Yeah, sure.
Okay. Is right now we're just staying in this area, and we refer to both of these as traditional or original Medicare. So back in the old days, before any of the other plans came along with these large deductibles and this coinsurance, they came up with gap or supplemental plans. And you buy a gap, and they go by letters, and you will get coverage so that you don't have that deductible, nor do you have those copays for longer stays. And you can wipe out your 20% coinsurance. So this is showing you what a gap plan comes in and does. It literally fills in the gaps in your coverage. Okay, so that's a very important component of when we talk about traditional plans. So now I'm going to change the format of this a little bit. And we're going to go to that line divides original from Medicare Advantage, obviously. And what we're looking at is original parts A and B are the 2 parts you always enroll in. You're not required to take a drug plan, but if you don't and you need it later, you will have a penalty. So I've marked that box with a red check. And they will say a supplemental or gap plan is optional. Our approach to that is it is not optional. You really need to have one of those plans. So we look at the left side of this as being a complete package of coverage. And this is how, before D, it really worked. Then in 1999, entered Medicare Advantage plans. What that does is it takes all those parts, consolidates it into one component. And you'll hear names like HAP or Priority or Humana. They will manage or they will handle, process, bill all of your care through their company. Okay, so let me make sure here. The Medicare Advantage plans appeared on the scene and went to Medicare and said, hey, we think we can do this better than you can, and we can save money for the Medicare system, so they were allowed to come into the marketplace. And we've watched them grow and grow and grow. And in the last few years, they've really piled on the extra benefits because they were given permission to do so to make themselves attractive as an alternative. And what happens here behind the scenes is even if you take the Medicare Advantage plan, you will still pay that $148.50. I mentioned that, but this is where it begins to ring true. You'll still pay that, and you'll still pay any Medicare Advantage plan premium. In reality, behind the scenes, Medicare is sharing some of that premium money with the Medicare Advantage plan. So they have an interest in seeing that these things succeed as well. So now, I'm going to get something out here for a minute. You may perceive that I have a bias towards original Medicare. If you go back to that original slide, it is my job to make sure that you know everything about all the plans so you make the best informed decision for yourself. So I will lean heavily on some of the things that I think people need to know. They are a Medicare Advantage plan can be a perfect solution for many people. As long as you go in knowing what will happen, that's a good result. All right. So one of the first things to get out of the way is when you make your decision, you see the caption up top, can you move amongst the options? And the fence is on here for a reason, because I want you to leave with that picture in mind. So let's start on the Medicare Advantage plan, because they're really attractive to people based on the advertising. So when you are first eligible, which is generally age 65, if you enroll in a Medicare Advantage plan to start, you have a 12-month trial basis. And what's important about that, if you get 6 months down the road and say, this really wasn't what I thought or intended for it to be, then you can go back to the original side of the fence with no questions asked. Not a problem. And again, they're trying to encourage people to check out these plans. Once you go past that 12 months, the only way you can get back to the other side of the fence is through underwriting. And let's clarify what we're talking about. With underwriting, the insurance company will give you a long form. It's almost like when you check into the doctor's office, complete all this information. And they will go through that, and they will look at your health history. They'll check other sites to make sure they've gotten the best information they can have. And then they will come back and they will tell you what your premium will now be for that plan. So if you have a health condition, you can be assured that the rates that you might have gotten at the beginning will now be higher. So underwriting is an important consideration to be aware of, especially if you know anything about your health. Being on, I forget I can use my mouse, I'm sorry guys. Being on this side of the fence, you can move within that every year, no questions asked. So if you started with HAP and you decided you want to go to Blue Cross plan, or you decided you want to go to Humana, we have open enrollment right now from October through December 7th. We have another open enrollment for these plans. They get a separate one that runs from January through March. So there's almost 6 months where you can move around in that marketplace. So that's it for the Medicare Advantage side of the house, and being aware of how you might make a choice to move elsewhere. When we come across to the other side, I had to turn my camera off, I'm distracting myself. When we come across to the other side, when you make your original decision to pick a supplemental plan, that's the variable that becomes very important. So once you pick a plan letter, and let's talk about letter G or letter N, etc., and you pick a company, like perhaps United Healthcare or Blue Cross Blue Shield or Humana, that's pretty much your picture. If you want to move within that arena, you will be subject to underwriting. And that includes, for instance, if you took a G plan as your gap plan, that's the most coverage you can get. And let's say, well, I'd like to scale back my premium, so I will take a N plan where I share a bit more of the cost. So even though you're picking up more of the cost, you're still going to be subject to underwriting, which can be problematic. Same thing, even though you might be moving within the carrier, you're already one of their people, same thing, subject to underwriting. So we work really hard with people to help them understand gap coverages and options, because you almost want to look at it as a pretty permanent decision. Okay. And I should say that if I haven't said this already, the terms gap and supplemental are very interchangeable. So no problem there. Oh. I'm looking for my next slide.
So Vickie, I
Yes.
just want, can you go back to that slide, please?
Sure.
I guess maybe, I'm not sure if anyone else is looking at this, but when you look at this, could a person take a look at this and say, okay, here's original Medicare, and then if they opt to go into the Advantage plans, that the Advantage plans essentially are adding the gap coverage, but you're paying whatever premium or giving up on benefits to get that kind of gap coverage that would not be part of Medicare, and that's why there's an attraction for people to go to the Medicare Advantage plans?
I think I want to restate that a little differently. You're on the right track, but what they do is they don't fill in all the gaps. They create a different series of gaps. Okay, so, and we're going to look at that in a minute. That I'll have an example for you in the demo that will show you how many of those sharing opportunities, and I'm putting that, I'm smirking when I'm saying it, they are sharing opportunities where you will pay more along the way. If you were on the original Medicare side and you had gone to a good core of coverage, you won't have any of those co-shares. So it's their way of dealing with the 20% on the Medicare Advantage plan. Does that help or make sense, or worse?
I think once you clarify more, it will make more sense.
Okay.
But the other part that well, it's just dissecting it, you know, so when you have where it's showing, okay, these are the things that are going on the Medicare side, and this is on the Advantage side, I think everybody would understand more once it gets dissected down and they look at their individual circumstance, because some people might need more hospitalization, some people might need less hospitalization, some people might need more medication coverage, some people might have less, some might have more medical needs that are going on even through office than others, and so that might be variables that will affect which they should pick up. The other thing I want clarification on, because I think this is something you covered before, but I just want to make sure it's clear to everyone, is that in the original Medicare, when they stay on that side, that as soon as they switch over to Advantage, an Advantage plan, if they don't switch back within a year, then they're stuck in there, and then they end up having to go back and go through all the underwriting as to, okay, you have this many medical problems, so maybe your premium might be a little bit higher than another, or coverage might be a little bit off, different for what they can qualify for. Is that correct?
You've said it well, but there's one caveat on there, and it's that first red line. They get only when they are first eligible for Medicare do they get to go in there and possibly come back. Okay. I think you mentioned that. So if I've been in original for 3 years and I then go to Medicare Advantage, I don't get a 1-year look.
Okay, that I just want to make sure that was clear with everybody, that you have that 12-month window when you first get into Medicare that you could try the Advantage plan. Just make sure you pay attention to the time frame, that if you're not happy with the coverage that's going on, that you switch back before that 12-month time frame.
Exactly.
Okay.
Exactly.
All right.
And I appreciate you jumping in on this stuff because that helps a lot. One of the things that sometimes is a good way to illustrate all this is if you look at this, it's like I put it all in one shopping bag. I don't have a Part A to pay. I don't have, or excuse me, no pay. I still have my Part B, but I don't have to worry about my D coverage because that's been incorporated into the Medicare Advantage plan or my supplement, and it's been incorporated in. Are the coverages equal? No. And that's what we'll be talking about.
But I was just going to say, again, it goes into the detail. I think the thing that everyone has to keep in mind is this. If you're picking between a Medicare plan that's going to end up covering all your hospitalization versus what plan could you end up here on the Medicare Advantage side that could end up now increasing your risk in terms of if you're being hospitalized on multiple occasions, are you going to have multiple costs related to that? And so you might have to anticipate that based on your health. And a lot of that would be based on your discussions with me when I'm caring for you. And, you know, from our side, we're going to do everything we can to keep you from being hospitalized. But sometimes, you know, you may need that. You have to take in account whether that could be 1 time, 2 times, 3 times, 4 times, or 5 times, depending on your medical condition. And that's going to help you make the decision.
Yeah, exactly. And I think that will become crystal clear as we go through an example. And that's why it's so important for people to understand what these plans are like. So I think, are you okay if we move on to the, okay. Okay. So, just, you know, when you write these, you try so hard to have them flow and then I get off my tangent. Okay, guys. Oh, come on. I'm pushing this button. Oh, the Christian's got to be on there. There, that's what I was missing. Okay, all right. So we could spend an entire 2-hour period talking about the differences between Medicare Advantage and original Medicare. And by the way, I apologize, but I'm going to back up 1 second. Last year in Dr. Calado's office, we did a Medicare 101 training or presentation, and that was in depth about all these things. So in order to focus on what I think are tips or highlights for this year, we are not doing that, okay? That's why I just wanted to do that little bit of a basic background. There's a wealth of information. We're always happy to do whatever topics you want, but this year, based on the things that are happening, we pick let's talk about the ads and let's talk about Part D and how to negotiate that. So coming back to this slide, that's why the word up there is key highlights. There are a number of things, but these are the things that I think are most important to those of us as we are trying to make this decision. So let's start on the right side again with the Advantage options. If you are not already familiar, if you take an HMO style of plan, you must stay within their network of doctors in order to have any form of coverage. If you go outside that network, take your wallet with you. So it's a restriction that you need to be aware of. If all your doctors are in that network, and I depart from talking to Dr. Calado's patients for a minute, that'll work for you. But if they aren't, you need to pick the right HMO where your docs are. So pretty much that's all I really want to say about HMOs, because this audience is here. It's probably not your best option, but I like to throw these things out because we all have friends and family who have conversations, etc. Before we were planning on Thanksgiving conversations, but I think that's off the table, pardon me. So the other option is a PPO, and these came about kind of out of demand because people said, I can't live with the HMO. Sometimes I just found out I have a cancer diagnosis and I have a oncologist that I want to see and work with. So now you can go see that oncologist if you're in a PPO, But if he's not in their preferred, that's PPO stands for Preferred Provider Organization. So if that oncologist is not in that organization, you can see him, but you're going to pay more. And again, you will see this when I take you through an example. The other thing, and this is pretty much with the HMOs, is that you may need a referral, which some people you have heard find that to be quite a difficult process. We'll leave that there. With the advertising, you're hearing about all the dental, the vision, the hearing, the allowances. Last year, we were very cautious about this because the dental benefits, and these were things that were not overly present. They've just come about in the last few years. So they're really marketing the fact that they have dental. And we have to caution that you need to look at the dental coverage because often it may just be cleanings, an exam, and x-rays, and that's it. You need a filling, you need a crown, you need a root canal, you're on your own. Similar with vision, it used to be just an exam, no care for your glasses, no help for your glasses, lenses, frames, etc. Hearing was also just an audiology exam. This year, they have pumped up the benefits somewhat, not extensively, but somewhat. The overall point here is if you are attracted to that, you want to make sure what you're getting. The next line is my biggest concern that people need to be aware of. Again, I'll illustrate it in a second. And this is a great example, Dr. Calado, where you were talking about we know how the original supplement works, it picks it up. But when you go across to the other side of the fence, what happens? Is it a supplement type of approach? And this is where it really falls down. Because if you are in a PPO, you will have a number of days for which you will pay a flat amount. So when you walk out of the hospital with a PPO plan, you've got a major copay. The average you can see is $1,630. That's the surprise you don't want. And that's the thing that we strive a lot with people to understand. That dental, vision, and hearing can look real good. And yeah, you're real healthy, but this was your bad year. This was the year that you were in the hospital once, maybe twice. Was all that dental and vision worth to copays? And you're looking at $1,630, that's the average, and they're more in the $2,000 to $3,000 range. Again, I'll illustrate that for you in an example. One of the new terms that has come up this year is they talk about a give back. New terminology, I don't know how people are figuring it out, but they will give you money back towards the cost of your Part B premium. If you recall, that number was $148.50. And some of these ads are saying that they will give you 100% of that back. In Michigan, we haven't seen that. Of our 22 Michigan PPO plans, 3 have a give back. We haven't had time to check them all out. We know that one of them is $35, which is a bit far away from that 144 that's alluded to in the advertising. So one of the approaches to think about when you're making this decision is, of course, overall costs. Think about original Medicare. You might have a higher premium, but it's much like any other insurance plan, whether it's your car or whatever. You're really budgeting a premium so that you know if you have an adverse event, bad health circumstance, that you've got as much coverage as you want or expected, okay? You can cross over that fence and you can get a lower premium, but as you go along, you're gonna have far more out of pocket through copays. The last highlight to point out is if you are a person who used to and plans again to do foreign travel at some time, the GAP plans, there are a few of them that offer you $50,000 in travel coverage. Now, you can always buy this on your own when you're making your travel plans and you're sure of how it works. And I believe, Dr. Calado, that also MDVIP has a perk involved like this as well. On the Advantage side, there is no foreign travel coverage, none whatsoever, okay? So with that, I'm kind of done talking about what you need to know, what's dig down into those Medicare Advantage plans and key factors. And of course, we can talk about more detail and it will make more sense when I do a demo for you. So right now, I'd like to switch over to Part D, or your RX coverage. Whoop. We stress every person should look at their RX option every year. So maybe after today, you'll feel comfortable doing it yourself. We are always available and always willing. But here are the reasons. First of all, in September, I know you got your ANOC. First question, what the heck is that? That's your annual notice of change. And it was sent to you by your current prescription plan. And much like it sounds like, annual notice of change, it may come in a 2-page letter. It may come in a 10-page flimsy paper kind of thing. They are telling you where the changes will be occurring in your plan next year. It's really great. We get in September, and what do we do with it? We set it aside, because the last thing I'm thinking about in September is my prescription drug plan for January 1st. But that's a very important document. And what happens here is they have put you on record of knowing what's coming, if we all read those things. And I understand years and benefits, people don't read anything until they need to have it, the information, so it's not unusual. So you do get that document, and what you'll see, some plans totally discontinue, they're gone forever. Some plans change their names, mergers, acquisitions, etc. In the process of that, some will move you automatically, and we had this in 2 instances this year. We affectionately call Mutual of Omaha MOO, and MOO had one plan, well, maybe 2 plans last year, but they had one plan that attracted a lot of people. It was under $30 for a premium. And this year they mentioned to you in the ANOC that they were moving up to their other plan now, which was costing just under $80. So if you didn't read that ANOC, you might have missed it. And I've got a solution for you here, so don't panic yet. And there was another carrier, and it got all mixed in because Envision became Alexa. They also bought Journey, which is going out of business, et cetera, et cetera. So a lot of things happening just in the mix of players on the table. When open enrollment began on October 15th, we had 2 programs which represented 6 of those 29 plans, Cigna and ClearSpring. And they were missing in the database for 2 years. Excuse me, 2 weeks. In my book, this kind of goes as unconscionable, because if you didn't work in this field, you wouldn't know it. And if you happen to go out early on and make your selection, you did not get those programs. So the real message here is don't rush out there too early, because these programs have had glitches. Last year was a nightmare. They totally changed everything. This year, way better. But we were surprised to have to deal with that. So we basically put everybody on hold for 2 weeks. So now the things that are really important. The premiums changed. We've talked about a couple of those. The formularies changed. This takes a lot of work to figure out your meds. Did the tier change? Is it still covered? What's the impact on you? In addition, new competition comes on the scene. Again, the players move around all the time. Programs, the next bullet is anyone sanctioned. Medicare is always reviewing, putting these guys through audits and scrutiny. And if you are a plan and you have gotten pretty low marks from your customer base, they will look even harder and they could sanction you. Over the last few years, we have had sanctioning. This year, I'm pleased to say, of the 29 plans, no one is sanctioned. But in a year or two from now, that could happen. This is my opportunity to talk to you. And they will not let new people into the plan. They will grandfather who's there, but no one new can come in. And the real message here is, maybe it's the plan you want to get out of. So well, that goes into the mix here too. One of the best things that has happened in the last few months in this field, there's a gentleman in Washington who had gone to the prescription companies, pharmaceutical companies, and said, we need to do something about the cost of insulin. And he waited and he waited and he waited. And in September, he said, that's it, signed an executive order. And it's known as the senior savings model. And my reaction to that is, what? Insulin coverage is that. A little bit of a hard to connect those two, and what's been going on with insulin has been almost an abomination for people. There are people who have to have this medication. When it was first discovered, if you will, the gentleman who did that said it should always be provided free to people. And people are finding themselves over the last few years paying thousands for their insulin. Just not right. It was a no-brainer for something that needed to be addressed. So this year, when you talk about a senior savings model, you don't really get that that's insulin. And it is my hope that the diabetic community is so wired in to know that this is out there. They now will pay can pay $35 a month for their insulin. That's like a miracle to those people. And so it's something that if you weren't wired in, you could miss, but when you went to plug it into your coverage, you would get the news then. But if you didn't plug it in, you might miss out on that. So anyways, with all these concerns, I hope you can begin to see why it becomes important to go through a review. But how do you go through a review? We have a very easy solution. So that's don't worry about checking your premiums or your formularies or who's new, who's sanctioned, is there a new drug coverage, etc. So I'm referring to that as take the easy way out. I'm going to the next, I'm going to give you some examples. I hope you can read that, but if not, the shading, I had mentioned that for the first year, we have that $6.90 plan premium. In the prior years, we've never seen anything under 12. So if you look, for instance, at the first case number, there was a person who was paying $352 for her drugs, whether she had a lot or a little. That's what her number worked out to be. She can now move to the new plan. Her drugs are free. Her premium is $60.90 times 12. Do the math. That's where the $83 comes in. She only has to pay the premium, and in he or her case, those they're generics and they'll be free. So there are 5 instances where people have benefited by going through the review and finding and being pointed in the direction of that $6.90 plan. Examples 6 through 23, you can see where just by reviewing the plan for whatever reasons, you have savings that range from $50 to $14,890, and we're going to talk about that last one in a minute. But this just gives you an example, the examples of where savings have been found for a variety of people. And there's nothing specific about this group, but you can see the spectrum. And I will agree with you that if you were number 6 or number 7, you might say, for $50, I'll stay where I am. That's okay, but at least you know the information. Remember, that's what we're about. You know, you make the decision, and that can be just fine. You know, you're not expected to move. We don't mind doing the work. We just want to help people know what works for them. So if you see my first, down here, wow, is that green bright? I hadn't looked at the screen. I'm busy watching my laptop, folks. So the total save for that entire column is $51,000 with an average of 2,254. But let's talk about the last person for a second. How in the world was someone paying $17,829 for their medications? Well, this is a person who said, maybe, I'm speculating, who thought, if I take the highest price plan out there, I'll have the best coverage, right? If I buy the Cadillac, it'll work well for me. It'll drive just fine. Well, he bought the Cadillac, and then he found out that a lot of his accessories weren't covered. A lot of his medications weren't on the formulary. So if he just looked at that plan and then went through the course of the year, it's a case of you don't get what you pay for. And sometimes, you know, it's human nature. A lot of people do that. But I know in this case, he was in the high price plan. And again, I want to qualify he or she. But I think it's, so that's the background on that. And you can see that he's coming down to $3,000 for this year. And if he didn't want that money, I know a charity that would. So, but I redid the averages over there on the right because I don't like to put in an outlier like the $14,000 one. So more of your typical average within this group comes in at 1,680 roughly. So those are some live examples of people who went through the exercise, and those are their findings. So with that, now I'm going to show you my favorite slide. My friends in the business are going to want to buy this from me. We have spent years trying to get this concept across. So what happens here, the exercise that I'm going to show you takes, and we'll ask you for the name, what'd I do? I pushed on my mouse. I just wanted to point. I need to go back to my PowerPoint. Thank you. This is why I need that emotional technical support. We will ask you for the name of your drug. We will ask you for the size, the pill size, how many milligrams or how many ounces, etc. It's all kinds of things. And we will ask for how many do you take a day? Hold on, okay? So we will ask for those three. Bernadette's answering me. I love it, okay? We will also ask you for some pharmacies, who you like to deal with. So when we get that information, we're going to throw it in the hopper or the funnel. The program is going to go through with that information, that size, how many at that pharmacy, and it is going to say, are these meds subject to the deductible or not? Figure the cost. What is the deductible? Is it $445 or is it something less? What's the premium over here on the right side? And it will look at, in the course of a year, is it possible that you will be subject to the gap? And the gap is the new politically correct word for the good old-fashioned donut hole, okay? So this program takes all of those things, factors them together, crunches it up, and comes out with one number. And that one number is your total expense project for next year based on all these factors. And obviously that's the best that we can do because these things can change, but based on this set of circumstances today, you can be assured that this is what your number will look like. So what, if you get that number for each one of 29 plans, now you have a basis for comparing the plans. And you don't have to worry about, because you'll see if it's on a formulary. And what's about being on a formulary? It's about, is it subject to deductible? What's my copay? Because it fell into such and such a tier. So this program is an excellent thing. Couple things that I give a lot of credit to the government for doing very well. And this is, we love this thing. So I hope that makes sense. I hope it helps visualize what it is, because if this all goes into the hopper, do you need to worry about the deductible? What size is that deductible? Or do you need to worry about the premium? No, because it's all been melded together to bring you to here. And when people see it, we still fall back into old, not we, but we have to coach on old habits.
So Vickie, how is that initiated? Is that something that's automatically done, or do they have to request for that to be done?
Well, let me push my button.
Got it.
There's a
Okay.
couple ways. There's a
All right.
couple. We counselors, area agency on aging, life insurance agents, et cetera, people who have gone out and decided to become skilled in this just on their very own curiosity. There are some people, Dr. Calado, in your office that I talked to last year, they had already gone through it, but they wanted to make sure that they had done it right, et cetera. So all of that's fine. There are people who will help you. But in the course of today, this is the demo that I want to show you. This is one of the two demos. Okay. So
Did you want a demo? Do you want a big?
yeah, we're gonna go to the demo. The demo is going to cover 3 specific areas. One is something called mymedicare.gov. And then we will do a quick look at a Medicare Advantage plan so we can see what some of those costs and copays are. And then we will look through this whole drug process, which is a lot simpler than what I'm betting you're anticipating. So let's start with mymedicare.gov. Now,
You haven't logged in, or you want to just go ahead and log in?
I have it on here as a share.
Okay.
Okay, so this is where I need your help.
I'm gonna move this.
Just do it, you don't have to, okay.
It's on here.
No, it's
Nope.
on that, it's on Chrome,
It's on here.
right here. Okay, thank you. Okay, so now we're live. We're live on the Medicare site. I might need your help with one more thing, Bernadette. Is there any way that on my laptop I can get rid of this right-hand side? It's blocking where I need to go.
Right. Let me take this. Let's see.
You know what? If they'll be patient, we can,
Let's see.
I was thinking I
Pause
could,
Just a second.
okay. Bear with commercial break if anybody needs to run anywhere.
And then we'll close
This is
this.
Bernadette.
And then, all right. So then I'm going to continue to let you share your screen because you're right.
Perfect, thank you. And you can drive if there's anything up there.
I'm there. Okay.
Well,
Let's do it for actually
Yeah.
logging in. Okay. Let's see.
yeah, so now I need my screen up there.
Yeah. I'm going to put it back to share.
Okay, thank you. I hope you guys are having fun out there.
Vickie, while we're waiting, can I ask a question?
Sure.
First off, I'd like to know, can I rewatch this video? I've been taking copious. Can I rewatch this video when we're done?
Yes, it's being recorded, and I also have a YouTube that's very helpful that is at the end of this. So you'll have 2 options. And actually you'll have 3 because we did this Saturday, so I will have time to incorporate some of the folks from Dr. Calado's group that would like some help, and I'm happy to do that.
Okay.
Okay.
All right. And then if I can continue here, you were talking about the Medicare Advantage. Did I hear you say that you lean towards the Medicare Advantage plan?
I don't think you heard that.
Okay. All right.
Yeah,
And I'll show you, you'll see, when you see more, you'll see why. I
Okay.
absolutely, only for some people do I lean for HMOs. And if you wanted to try PPO for a year, but make sure you might want to hop back to that gap, because longer term, if money is not a primary issue for you, I tend to go a little more to the original side because of the freedom of choice, because of the no surprises. Maybe the foreign travel, but so let's revisit that as a group after we look at an example. That be okay?
Sure. And lastly, is Dr. Calado, are you an HMO or a PPO?
For Medicare, I think that's something you're referring to what we accept. I think we accept all of them.
Okay.
I think you accept PPOs, but some of those carrier, the question really is if he's taking Blue Cross Blue Shield payments, or if he's taking Humana payments, or if he's taking Aetna payments. Yeah, and that's billing area. There's no hurdles there, but an HMO, to my knowledge, and you can correct me, you haven't specifically signed up to be a doctor on their network and only, I don't believe.
I'd have to check with our staff on that.
I understand.
Sure.
And first of all, I will tell you right now, is if you call an office to check on anything, you always want to ask for the billing person. Even the reception area, they don't feel comfortable answering your question, and they're not the best in the best position to do that. So the billing people are really the ones who can help you the most. Okay.
Thank you. All right.
I guess I would say the tough thing about answering that question is because each one of those, whether it's Blue Cross or it's Aetna or any of the other ones, Cigna, they all have their PPO and they have their HMO that's within there. So for me, I always see just the parent insurance,
Right.
and whenever we get a reimbursement, whether it's Cigna or it's HAP or it's Medicare itself. So
Yeah.
I'm not sure whether it's really broken down in terms of HMO and PPO, but that would be something that our billing company can look at.
Yeah, and I bet there's somebody new in your office who can help you too. But anyways, but he's absolutely right. It's not something that the doctors, this is an area they turn over and trust other people to manage for them. They'll talk to them about options, but
Yeah.
so they're in the loop in the beginning and then they turn it over.
Again, I'm going to say that I'd rather focus on taking care of you than to really worry about the insurance. I think all of you know that when I'm taking care of you, I mean, I keep that in mind about your insurance coverage and things, but I don't let that dictate for the things I know that's best for you. And all of you know that I'll fight for whatever is going to be the best for you. And before you go into this part of it, I just want to make a mention about the medication, because I think everyone's going to be looking at this, their costs, their medications completely fixed, and that there's not any leeway on it. There are things like goodrx.com that can end up helping to bring down the cost of the medicine, so that instead of getting it through the mail order services, you might be able to get it through the local pharmacies and pay for a lot less, and that can cut down your risk on cost. The other thing that's also important is about this tier exception. And a lot of people don't know about this, is that if your insurance is saying that your copay on something is going to be $200 or $500 or $700 or whatever it is, it could be some kind of ridiculous number, that you could actually go back to your insurance, whether it's Medicare, it's Blue Cross or Cigna or any, and this is regardless of whether you have Medicare or you don't. Even if you have a commercial insurance, you can go back and say to your insurance, and this has to be initiated by you because you're the subscriber of your insurance. For us as our medical office, we can't initiate this for you, because all we're doing is saying you need to be on this medication they don't have any ownership to us to say that, okay, we're going to give it to you for this lower price. That's something that you have to request for. And the way you're going to do this is you're going to tell them, I met with my doctor says I have this condition, I have to be on this medication, there's not an alternative for it, and so it's to try to prevent something, and that the cost of me paying this copay is too high for me to cover. Can I have a tier exception? And then they'll review everything. They'll probably ask for our notes and then talk with you more. They'll then take that into consideration, and many people will tend to get a tier exception. And I'll give you an example. Repatha is a wonderful drug, and then many of you have heard me talk about it. It's a medication that can essentially reverse cardiac disease, but it's a very expensive medication. When it came out, it was $17,000 a year. And then it actually went down to $5,500. And so there were people had to pay a copay that was $400, $450. And so when they asked for a tier exception, they were able to go down to about $40 on the copay. So you got to request for that. And you do that with all your medication. So I guess the bottom line about all this is you have to be proactive about everything that you have in your coverage. Okay? Sorry, I just want to make sure that everyone understands.
I'm going to use Repatha as an example in this demo. It's a hot one.
All right.
Thanks, Dr. Calado. We're teasing you over here. You know that. Okay, so let's go back over here. We are now on a live network with Medicare.gov. And up here, if you see my Medicare.gov login, this is something that you can do. And I'm going to show you. I'm going to do this. We have a little sheet, and I'm happy to share it with you, and we'll talk about how to make that happen later. But this is as simple as it is. If you want to go in and create your personalized Medicare finder, it takes 5 pieces of information: your Medicare number, your name, your date of birth, your zip code, and when your Part A was effective. All you need is your Medicare card. So if you go through that process and you log in, it is going to make your life a lot simpler when you go through a drug review or a Medicare Advantage review, etc.
Do you want to go back to this website?
Yes, I thought I'm looking at mine. I think I am. Oh, thank you. Okay. Thank you. Okay. So what happens here is when you log into your live site, the first thing you'll do is get over how much Medicare knows about you, because they've got all your medications in there, because your drug plan reports through them. They know everything about your doctors. They know, of course, they know every claim that you filed, etc. So when you log in there, things like I mentioned to you that we would ask you for your drug and the pill size and how many. Some of that is pre-populated for you, which makes your life a whole lot easier. You just double check it. And again, I'm going to show you this. If you decide to enroll in a new plan, you can do it right from here, and your application will also be pre-populated for you. So there's a lot of convenience built in. But for sake of demoing this, I'm about to bare my soul to you. And I just clicked on my login. And I want to go back for a second because you saw me click there. This is the Medicare.gov site. I'm sorry, I should have said that. You just put it into your box, grab it. You see 2 boxes here, and you'll see these during open enrollment. So either I clicked here, or I could click here, or I could click here. Okay, so if I want to I'm willing to put my meds in. I don't care about my information being personalized or pre-populated, etc. This is one of the ways that you can do that. If you go to this line right here, continue without logging in, we refer to that as doing it anonymously. So if you just want to play around, that's one way to do it. We don't think there's any ill will going on in this site, but sometimes it's a quick way to just get in and get out for some reason. So you could either log in, you can create your account, or you can just go through. So now I'm going to go back to that first cover, if you will, sheet. And my choice is I'm going to log in right here. Almost the exact same step, but I just want you to see how these things work. And when I said I'm burying my soul, I can't create a mock person out here. So if I work with you, you have to share your information with me, and I'm sharing my information with you. I did go in and doctor up my medication list because I just did. So you have now just come onto your personal information at mymedicare.com. You can see my name up here. You can see that I have a message, and the message was about my flu shot, and then they recorded that I had gotten my flu shot, and I can prove it to you, Dr. Calado, if you need to see it. But so anyways, or we can just move right to finding my plans. It shows you where I am now, when I originally started. But before we go into the purpose of the demoing today, I just want to show you a couple more things since we're here and the value of this site. If you just scroll down, for instance, when we all got a new Medicare card, it wasn't plastic, it was cardboard. A lot of people went out and laminated it and weren't too happy about that and so forth. Well, the reason for that was you can now go here and print your Medicare card. Okay, so that's one of the conveniences. I can go here and I can view all of my claims. And of course, it's got the typical filters where if I said, oh, I want to look at the last 6 months, I want to do all types, sort them by newest service date, apply the filter. And I now have a list of every claim that has gone through Medicare. This is Medicare, not your GAP program. So one of the things about this, and of course you can go on here and look at all the details about that. You can ultimately get to your EOB, etc. So let's go back for a second. What happened?
I don't think it wants to go back. Just go ahead and press enter.
I don't have these things happen. Sorry. I'm so glad you're here. Okay, thank you.
You're welcome. Let's see what else.
I always just start over, I guess. Sorry about that.
You wanted to look at.
So you've got all kinds of, if you want to know where you are on your deductible. I've met my deductible for this year. Dare I go back?
Yeah, you can go back. Or you know what, actually just do your drop down. So
Well, that's what, yeah. So if I want to see us, and if these are our favorite forms. Internet's working.
Yeah.
And this,
It's going to want to it's going to show that summary. Yeah, go ahead.
now I've got it to open.
Yeah. Mm-hmm.
You've seen these before, I'm sure. So one of the reasons that I like for people to become comfortable with this, and I don't consider myself a person who's all that trusting. I like paper. I'm still old-fashioned like that. This is one envelope that I don't need to get because, as you well know, it's got a lot of miscellaneous information in there. All I really care about is this information right here. So I've got 3 other pages, and this is my Medicare aspect of it. Now my supplement will come along and tell me that they're going to pay this difference. So what I really care is about their paperwork rather than Medicare's. So I'm fine with shutting off the paper here, and it's something that you might want to consider because once you begin to realize how much is on this site, you can feel more comfortable about that. So I'm going to go back. And now I'm going to go home. Let me make sure. Oh, okay. I want to get back to my home page here. I got it. Okay. So down here, and this is just a little thing you might overlook. I can either update my health information here, or I can create a report. So let's look at this create a report. What do I want in here? Do I want my claims? Do I want to look at my emergency contact information? Do I want to look at the preventive services that I've had done this year? How am I doing with all those free things that Medicare will cover? Have I had all my screenings, etc.? And I'm just to show you something. I'm going to select the last 12 months. You always have to agree and then create the report. It's going to work again for a second. This is going to blow you away. I have 12 months of claim information, all the details at my fingertips now. So for those of you who like to figure your taxes or see where some of that stuff is, you can get downloads here. You can create whatever report you want. You can also do that with your supplement plan if you've not ever experienced that. So, okay, so I think that's pretty much for the fun of this site. So now let's start talking about the demos we intended for today. So the simple one, I've just clicked on find the plans. It's going to ask me, what are you here for? Are you here for a Medicare Advantage plan, a drug plan? This is not very helpful because they give you the impression they're going to give you Medigap information. They're really just going to point you to, you need to call somebody. So we're really just working in these areas. So I mentioned we want to look at a Medicare Advantage plan. So I'm going to check that. That's my zip code. It says confirm your drug list. Why does a Advantage plan care? Because they're covering my drugs. So I just scroll right down here real quick. For simplicity, done adding drugs. And so where are you going to get those drugs, Vickie? I'm going to go to Kroger's. And show me all the Kroger's that are within 10 miles of me. I'm just going to grab one for sake of getting through this Medicare Advantage slide. I'm done with it. You'll see this again later. Now, it has brought back for me 54 Medicare Advantage plans. What is that 54 telling us? It's the 32 HMOs and the 22 PPOs. I know I was asked about, I admitted my bias. So right off the bat, I want to filter these. So I'm just going to get the PPO organizations, okay? I do believe that if you're a patient of Dr. Calado's, even though he'll take care of you no matter what, but I'm not interested in an HMO. I could filter it for a star rating if I only wanted to see Blue Cross Blue Shield plans. And we want it to include drug coverage. It will show you the 3 that don't include drugs if you don't. Obviously, I think that was a silly statement on my part, but there are 3 that are out there, and I wouldn't want you to make a mistake and not catch that. So now I'm down to 19. I'm going to scroll down here. This is just the first thing that comes up is my current plan. They just recognize my PDP plan. I start to scroll down here and I start to see all the Medicare Advantage plans. Here's Medicare PPO Essential. Remember, I selected PPOs. Here's a high level. I don't even stop here. I don't care. I've got Humana. I've got Humana Choice. I've got Priority, and we can go down the list. But what's important here is that I can dig deeper, or I can enroll, or I can add it to a compare. So my purpose here today is to just show you the detail. So I'm going to just pick this one plan and I'm going to click the compare button. Well, no, let's click 2 so you can at least get the benefit of a compare. So I now have, again, this is a high level look at these 2 plans. This one's free. This one's got a $20 drug, or excuse me, premium. This has a $100 drug deductible. This has $75. They have different max out of pockets, and we're not even going to stop with this information because here's the purpose of our mission today. I just took that one plan and I said, I want the details on this. And again, I could go to different areas, but let's take it from the top. There's no premium. Yes, you are still going to pay $148.50 a month for that B coverage. You do have one deductible. You can forget this because it's built on a lot of assumptions that don't help anybody. This is probably the best place to talk about them. This is a max out of pocket. An Advantage plan has to think in terms of a max out of pocket because what that means is if all of the expenses that you pay for out of your pocket ever total $6,000, my phrase is you're off the dime. Your losses going forward will, or your claims going forward will be 100% paid after that point. So a max out of pocket is a variable that, of course, a Medicare Advantage plan needs because you have copays. Mentally go back to the original original Medicare, and where you have your A and B and a supplement. Nobody ever talks about a max because it doesn't apply. You've got that maximum amount of coverage where you only had your $203 deductible. You could be in that position that you only have the $203 deductible. So they don't have to worry about a max. It just pays and pays and pays, okay? So scrolling down a little bit further, if you go to a primary doctor, one of those that's in the network, and if you want to look at the network real quick, and there's caution here, networks are not always as current as they should be. Call your doctor to confirm they're in the network, please. So let's say that Dr. Calado is in the network, and I will see him at no cost if I am enrolled in the Blue Cross Blue Shield PPO Essential Plan. If I go to see another doctor who's not in the network, guy down the street, for some reason I chose to go there, don't ask me why, I would have a $25 copay per visit. There's where you start. To keep choice, you pay more, okay? Now we escalate to a specialist level. In the network, you'll have a $45 copay. So if I'm sent to see a specialist, even though they're in the network, there's another out of pocket. Goes up a little bit. All your tests can be anywhere from $0 to $150. Lab 0 to 140, or excuse me, 0 to 40. Diagnostic x-rays. Now we're starting to get into some of the pricier things, CAT scans, MRIs, etc. 100 to 150. Do you feel your wallet draining yet? Emergency room visit, $90. Urgent care could be up to $50. Here's the thing I worry about right here. If you are inpatient hospital and you're in an in-network hospital, which is pretty hard to, you just about always are. All the hospitals are in these. For your first days of 1 through 6, you will pay $325 a day. So let's say you're just in there for 1 day. There's your first $325, cha-ching. Up, you're being extended. Now when you leave, you're gonna put $650 probably on your credit card. And if you stay another day, now we're up to $975. And I think you get the message. This is the one that if you don't go through this, there's a tendency to not come across this information. Again, you have some more co-pays out of your pocket. Skilled nursing care, there's your after 20 days, you have some co-pays. What happens with original? They pick that up. And I should have said, what happens with original? If you have that $1,400 one, they pick it up. Preventative services, this is great because by law, they're all covered at zero. If you needed an ambulance, if you had outpatient therapy, $40 a visit, etc. So the point of this is you can go into these and look at the detail, and you can look at this for all of the 22 plans, okay? Or you can compare a couple. So down here, here's where you can see routine eye exam, $10 copay, contacts, lenses, no copay, glasses and frames, not covered. Frames, there's some coverage. I'm looking at this going, yeah, no upgrades are covered, and we all know we get into that. Chiropractic services often not covered over here. Acupuncture not covered, and this is a bit of a mystery because this year, one of the changes in Medicare was that acupuncture was being covered, but I believe it's limited to low back pain at this point. If Dr. Dan were here, I presumed he's heard the good word. Now, down at the very bottom, if you want to beef up your dental coverage, we'll let you add on a premium for $21.40. And here's the thing that we're going to get used to looking at. They will lay out your drug costs through their program. This is how it's designed. Tier has the copays, but more importantly, here's what they anticipate. Remember I said I'm going to Kroger. Here's what they anticipate my costs will be through Kroger network, through their program. And if I looked at this, I could be tempted to jump on board right now because that's a very low cost for me, okay? This plan will lay it out on a different basis, but I don't want to, if you would be tolerant with me for a second, I don't want to focus too much on the drug costs right here because we're going to go deeper when we flip to that demo. Because right here, this was just about the Medicare Advantage plan. And the point is that you have a wealth of information at your fingertips. If this is something that's of interest to you, and if it's of interest, you want to know where all those copays and your cost sharings are going to come from. So hopefully this illustrates the point that Dr. Calado was talking about, and we've referenced in the slides that these plans, I don't have a premium, but during the course of the year, I will have some costs. So I hope that's been illustrated here, and there's a way to get a handle on that information. So, okay. I'm going to assume that we're okay on the Medicare Advantage. Okay, and I would like to go back to, I'm going to go all the way back. By the way, within this, there are lots of print buttons, and whether you want to print it or save it to a PDF, you can always go backwards, which was something they did not give us the capability to do before. So let's go all the way home. Let's just make it easy, okay? So we're going to start this search all over again. And whether I'm signed in here or whether I'm logged into, if I'm going to just go all the way back for people's comfort. So I can just do this, right? Oh, fine. Okay. I think I still want to do this. Okay, so we didn't get all the way back to that one green screen with the couple talking and everything, but let's go back to, because we're going to do a live one and we're going into my account again. And I got to warn you, my voice is going to go down. You may have to step in now. Yeah. I'm sorry. No, I'm okay. I think my face is on camera because I see it. I'm not. You guys can't see me, right?
Yeah, we can see
No, well, sorry.
you. You look beautiful. You want it?
Okay, so here I am back again. I want to find, excuse me, I should frame this. We are now done talking about Medicare Advantage plans, and we're going to move over to using that drug demo, because this is where I really want you to feel comfortable, or at least willing to say, hey, I think I could do that. So we saw this before, and it's, so Vic, why are you here? Now I want to look at a Part D plan. So I'm going to just click that. Again, they want my zip code. And next. For me, this came right up to my drug list because I've been in there before. But when you open it, you will see this list. It will say, here's your drug list. Here's what we know about you. Okay. And I can literally populate from here over to load that. And I'll show you an example. But this is one of those nice benefits of the fact that I am logged into having a My Medicare account. It's going to give me my personal information. So I'm not going to take anything from here for the moment. I'm back to my drug list. And I will tell you that I manipulated some of this so that we could do some play and things like that. So right now, these are my meds. I want to quickly look at them. Oh, anybody having this, that was a one-time prescription. So what I want to do is I don't want to factor that in to my next year information. So I'm going to just hit this button. Poof, it's gone. It's gone from this list, okay? So I also know that just recently, about 2 months ago, so it might not be on my list yet, but I'm on doxycycline. So I'm going to, it has now put that onto my drug list. But I'm not on 2 milligrams now, I'm on 1 milligram. I might have done that too quickly. I have two options here. We just use remove a drug, and now we're going to edit the drug because this information isn't accurate at this point. So I'm going to go in here, and this is a screen you'll see a lot. I go to click on the drop-down list. There's all the options that I have. And if you want to mix up one of us counselors, try and tell us something that's not on that list because we don't know what to do. I am taking I like to look at this. I can do this as either I take 2 pills a day or 1 pill a day. I can make this be anything I want. So if I wanted to say I take 30 pills every month, I can do it that way. Most of us have become accustomed to, I don't want to be in there all the time at the pharmacy at Kroger's if I'm picking it up. So I'm going to take 90 and I'm going to go to every 3 months. And it's that simple. And I say, add it to my drug list. So it's gone in, and what used to say 2 milligrams, oh, I made a mistake.
Yeah, that's okay.
Oh, no, I'm using that. I'm going to go fix my mistake. I take 2 a day, so I need to put 180 in there. Okay. So now this is the correct medication for me, and I've added into my drug list. Let me see what else. Oh, so another thing that's just come along is I've really had the COVID stress, and I'm begging for some help from Dr. Calado. And I'm gonna, he just agreed that I can have a medication, and we're gonna put, it could be Xanax, we could put in Trintellix. And Doc, if I'm not prescribing these things quite, please forgive me. I don't have that degree. So if you noticed, let me do this again. It will help you find those medications. And I'm gonna say, add that. I wanna add that drug to my list because next year it's gonna be a regular for me. What's the dosage? I'm taking 10 milligrams. I like all my medications based on 90 days. And if you go slowly, you don't have to worry about this. It's easy to do. And I'm going to add that onto my drug list. So now I'm happy. I've got everything the way I want it to be. So I just come down here and I say, done adding drugs. Now, remember that they were going to ask about a pharmacy. Again, I'm going to use Kroger's. And one of the things that a lot of people, when you see this, and they'll say, oh, wait, which is the right Kroger's? Any Kroger's is fine. It's a chain. Any chain store, you can take any one you want. And it has added down here at the bottom, Kroger is one of the things we're going to look at. So now I also want to see, well, maybe I'll start going to CVS or Costco or whatever. Once again, it's a chain. I'm just going to grab one. Maybe I should look at mail order. We'll put mail order on there. So you can play here a whole lot. I'm going to keep it to these three. And one of the things is you can keep doing is coming back and changing this list to see what it does to your medications. Another variable here when we're looking for pharmacies is if you look at, for me, if I change this mileage factor and I come out to 10 miles, and you may know that we have a pharmacy in the building called Med Index. Scroll down and I can add them as well. Okay. Now, if you don't mind for the moment, I'd like, it doesn't matter. We're going to just go here. So now it has run all of my information. Remember that funnel? That's just happened. And we're going to go in, and here's my current program. For my current WellCare Wellness, I can expect at the retail pharmacy to pay $28,000 next year. Okay?
2,800.
I'm sorry. Just felt like 28,000. I'm sorry. Thank you. So then we can go down, and what it does is it stacks these based on the lowest price. And again, it's that it's already factored in your drug and your premium, your drug cost and your premium. So now this plan will cost me $22.67 compared to that $28.51. The next plan will cost me $23.61. Not much difference, but it's stacking them based on that number. Okay. So again, we have this nice function called a compare. And one of the things is it will always add in your current program. So you see that already placed down here. You don't have to carry it. Once you get used to this, you may drop it. I will add this one. And I can add the next one. Just for illustration, I'm going to go down here, and these are all pretty tight. But just so we can see where things come out. And all I'm going to do is press the compare button. Here we're limited to 3, just like before. So if I don't do anything, this is my next plan. So again, this comparison is a very high level, just like the last one. Do I care about what the premium is? No. because it's been factored into that funnel. Do I care about what the deductible is? No, it's been factored into the funnel along with if my drugs are affected by that. So what I really care about is this information right down here. And what it has done is it has said for your current plan, if you go to Kroger's, you're going to pay $2,800. If you go to CVS, you're going to pay $33. Med Index $32, and if you go to mail order, almost $2,800. If you go to the next best plan, and you have the names down here, you don't always have to scroll to the top, you're going to see the same set of numbers. Now, this is a page that I tend to print out because I want to take my marker and I want to start circling stuff. Just say that if I go here, I need to change my pharmacy, maybe. Let's see, 22. Med Index came in as a better price for me. Okay, over here, Kroger's remains the better price unless I want to go to mail order. So right there in front of you, you can start to see all those things have been consolidated and fed back to you as one number. So with this, I'm interested in the same kind of information as we did before. I want to look at the plan details. How is this going to work for me if I go to this program? Click on plan details, start scrolling. No side by side, but here's the way the plan is structured. I don't have to focus on that too much because if I continue to scroll on down, and I'm going to focus on Kroger because that was my best arrangement. Here's the retail cost per Kroger for this medication. I've got to meet my deductible first for some of these meds. If you look down here, let's look at this one, doxycycline. That is not subject to deductible because right out the door, I just have a $3 copay. And since I'm getting 90 days, it shows 3 copays at $9 in this case. The methimazole. I don't have to say these things with the doctor in the room. Okay. It's not going to be subject to deductible. It's just the straight price right on through because it's less than what the copay would be. So you keep on going and oh boy, bingo. But what happens to my Trintellix after I've met the deductible, and I will tell you that I intentionally put on a rather high price spread for this, and I have a tip for you that hasn't come up yet. After the deductible has been met, these are now the prices that I will pay. If I go into what's the coverage gap? The donut hole, the old donut hole. I go here. If my costs got to be way high, I would come into this final gap, which is 5%. So again, it's going to reiterate my cost and some of the factors. It's also going to show me that the reason I paused is I really didn't want these Februarys to come in, so I must have methimazole in there as one that I'm getting it filled every month. But so in January, I'm going to pay $761. In April, I'm going to pay $506. In July, I'm going to pay $488. And October is $358. And I know why I'm paying so much is right here. Okay. So that's one example. And if I go to I keep scrolling, now I can see my costs that I'll have at CVS. Or I can see my costs at Med Index. Or I can see my costs through the mail order program. So again, this is something where you've gotten almost more information than you wanted. One of the things that you can do right away, or should do right away, is there was I'm going to take you back and show it to you. There's a spot where it says subject to restrictions. Restrictions in your coverage are usually related to your quantity limits. So for instance, right now I take 1 capsule a day. I could be allowed to take up to 2 capsules. I don't, but if I was prescribed more than 2, I would bump into a quantity limit. And this is something where my plan would start writing to me and say, you can't be there. We may fill your first one, but we're not going to fill any more unless you talk to us. We'll give you an appeal form and your doctor can fill it out, or Jen can fill it out, send it back, and we'll consider if there's a medical need for you to be on that. And that's the kind of thing that Dr. Calado was talking about earlier, that there are always appeal options. But if there was, and we don't find too many problems in the quantity limits at all because doctors don't overuse those medications. If there's a prior authorization or a step therapy, then that is saying that you're going to have to go through a little bit more protocol, but you are not excluded from getting that medication, but you have to comply with whatever they're asking. So for instance, in a step therapy, they may say, well, Vickie, you want to be on this brand name Trintellix. Oh, good, we have an example. Are you sure that other alternatives have been tried? Did you have to jump to this one first? Remember, this is the drug company thinking of, I don't want to put out all this money if I don't have to, so we're going to raise the question. And again, this is where your provider, your medical care group will be helpful in responding to them and saying, well, we tried, can't even think of other names, Xanax, or we tried something else, and they have that in their records, and they supply that, and the pharmacy, your plan will come back and say, oh, I guess you've already stepped through those things, and it's okay, we'll allow it. And they'll usually adjust the tier on it too. So you have 2 things going on with that one. So I've probably overwhelmed you with this. As you sit and look at it, you'll be okay. What I'd like to show you is you can go back to the plan comparison, and I can keep moving back and back and back. And here I got back to my edit your drugs and pharmacies. So there's 2 things I want to do right here. I said that I was going to add in one. This drug is really gaining in its popularity and necessity. Whoops. Is it working? It's.
I think it's highlighted. Go ahead.
No, that shouldn't be. Hold on one second. I wondered if maybe there is the internet. Okay. I'm going to select it here. I'm going to say add the drug. And this stuff comes in an auto injector. I'm looking for the one that says 2 in a pack. Let's see. Here we go. So if I take this every 2 weeks, I will need 1 package every month. So I will need 3 for every 3 months. 3 packs of 2. I'm going to add it to my drug list. It's that simple to put it on. I'm going to come back down here and say, well, we got it. Done adding drugs. I'm going to stick with these pharmacies. No, I'm going to knock the mail order off of here just for convenience, just to make things a little simpler. And CVS, I'm taking off. Kroger's and CVS either match each other, or Kroger comes, generally speaking, Kroger will come in better. So it's just things that we've seen as time goes by. So once again, it just crunched it all through that funnel, came out with the numbers. Now I'm looking at this cost with my WellCare. Well, that for sure is something that I have to address. Again, it's coming back to the addition of Repatha to my medical information. Humana Walmart. At this point, I don't even care I don't care what they do. I'm going to take them off here. And I actually am going to unload all of these so we can start with a fresh comparison. So here's my lowest cost. This one's pretty close. This one's pretty close. So again, we can look at, so where are my costs? Well, I'm probably going to go to Kroger. Might be tempted to do, come to, excuse me, Kroger, MedIndex, Kroger. Okay, so this is my least expensive plan. Let's go look at the details. My Repatha here is for the first month. They're telling us the cost is this. Once I've met my deductible, it's going to come down to $255, which is a 3-month supply. So however you like to think of that, or $83 a month, I believe it is. Much, much better than what I was seeing before. Must change my drug plan. I knew that was coming. You can do the same thing. You see the MedRx numbers. So I guess, oh, I'm going to do one more thing because I'm going to go back to the comparison for a second. This is where, if you didn't look before, you can also see what restrictions you might have here. Again, very important. I can assure you that all of these are just based on the size or the volume of the quantity, excuse me. Okay, so with that, Dr. Calado alluded to a couple of things that are really wonderful things. Good RX. You can look at this and you can go out to Good RX and you can, if you haven't used Good RX before, you put your medication in and your dosage, much like this program, and it will come back and tell you what the cost will be with one of their coupons. If that coupon cost is less than one of the things, one of the costs that you see in here, use the coupon. Okay, not a problem. It won't be registering on your My Medicare and going towards your gap deduct or gap cost, but that can be addressed later if you need it to be. It's a detail you don't even want to think about right now, but you are free to use those other programs, and there are times that they can come out better. I'm not here to promote Kroger, really. Kroger introduced, I believe it was last year for the first time, a Kroger savings plan. One of my medications, and I believe it was maybe the celecoxib, what it cost me to join the Kroger plan was $32 for the year, and my very first fill saved me over $40. So again, there's a no-brainer. You cannot stop the search, I guess. I have a lot of passion around this cost of medication in this country. It's just crazy. So that's one. Another thing I will dispel, although these examples didn't illustrate that, but mail order, we always used to think, and it was in the beginning, that that was the great answer to getting the cost of medication down. Not so much the case anymore. Always look at it, but don't be surprised that it's not going to be the winner category. And then lastly, and I credit Dr. Calado's office for this, because of COVID, let me stop that. There are a number of pharmaceutical companies that recognize that the cost of some of their medications is really out of reach for a lot of people, but maybe they really need to have those medications. So they have gone and started programs, maybe they call them foundations, whatever, but you can qualify to get those medications at a reduced cost or perhaps in 2 cases free. And I am here to tell you that I was stunned this year because I have, for this year, because of COVID, they raised the hurdles. And I was stunned to see that I could qualify for a couple of those. And we usually think of that you need to be indigent or something, but the income levels were almost up to $90,000. And I don't expect to see that in something like this. So Repatha and Trintellix, based on providing them with information, thanks to the staff here, I would have never thought I would qualify, and I qualified. So it's just an endless search, and you're always wondering what else can you do? But the real point of our mission today is that you have a tool, and if you're not comfortable with it, don't panic. There's help out there, but I think if you give yourself a shot at it, you'll be surprised. And again, you don't have to go in and set up your My Medicare account. I would, it'll make your life easier. But with that, I'm going to pop back to the PowerPoint for a second. And I said we always talk about fraud. This problem is bigger than anyone can imagine. You want to protect, and I'm going to do it quickly. You want to protect your number and card. You need to know, just share it with the providers you trust. And I love this statement, because if you don't want to give them your Medicare number, I got to wonder what you're doing in their office. But that's your call. Medicare will never call your home. And I know you're getting a ton of calls right now where they're doing a lot to suggest that they're calling for Medicare. Hang up. You are the inroad to us helping find fraud within the system. And your Medicare summary notice, we looked at one a minute ago. I thought I had one. Okay, we're not going to worry about it right now. We looked at one earlier. That's your way of helping. If you don't recognize that service, you don't recognize that date, it's a great idea to supply multiple dates and file those claims, because who's going to catch that? If you don't recognize that amount, the reason you were there, that's a reason for concern. And you want to call your provider to make sure. And if you don't get a good answer, then you want to report that on in. A couple other small tips. Fraud is the most common scheme going on against seniors. We think it's finance interruption, but that's not it. Medicare does not endorse any plan. You're looking for services you never got, equipment you never got or returned, or companies that are falsely leading you into anything. So with that, I mentioned a couple of things at the end. MAP as an agency is we're always here to help you. For this group, for Dr. Calado, I am very happy to help out his patients. While I'm asking is because this closes down on December 7th, and I have a caseload, if you will, that I get from the agency. So I'm doing that, and I'm doing this group, and I'm happy to do this group. But I would ask that you reach out to me before Thanksgiving so I have some sense of how jammed life is going to be. And you can call and leave me a message. You can send me an email. Don't be concerned if you don't hear back from me instantly. But once you get in there, you're on my list and you will be helped. And I do have a couple names already in case there are a few of you out there going, I thought I gave her my name. You're on that list. So there are, I believe it's 4 of you right now. I mentioned that there was a YouTube, I think we had a question earlier, there's a YouTube video out there that will also take you through things that I've just done today or the recording. And all you have to do is go out to YouTube and query how to use Medicare Plan Finder. And they'll show you in 20 minutes what we've just spent all this time doing. So not quite to the depth of review, but so anyways, with that, I am done. So if you want to field it for questions, or Dr. Calado, if I consider us both open for questions. So I guess you go to a total unmute.
Yeah.
Okay. Will I see the questions on the side?
They will come up and talk with you.
Okay.
If you need it.
Do I have a question? No, I got to thank Dr. Calado for Repatha. Give him a
Oh, glad to hear it.
I think you do it.
Pardon me? Oh, you heard me?
Please do it though.
Dr. Calado, you're still on mute, so you might want to unmute.
So,
There you go.
yeah, we heard you. Yeah, Repatha has been a wonderful drug for everybody. It's unfortunate that there's a lot more people who don't know. The problem is there's a lot of internists who don't feel comfortable about doing it, and there's unfortunately a number of specialists who don't want to go through the changes that need to be done, or the forms that need to be done to get people approved. But that's far from what the purpose of this is. This major thing is for all of you to understand what Medicare is about. How do you log in? How do you get the information? This has been really a tremendous thing to be able to see the drugs. It's really kind of sad for me to think about this now over the years, that there are superior drugs that people have been on. They know that they've done really well. Then things change and they get that notice that medicine's going to cost this much, and it causes that sticker shock to end up happening. But going through this exercise and seeing how a medication starts off expensive at the start, but then it really tremendously drops towards, after you meet your deductible, is huge, because most people are going to think that's the way they're going to pay it every month for the rest of their life. That's going to happen, and it's not. Plus, knowing these things about good RX and also about tier exception, and also the additional assistance programs that can end up helping to really cut down the cost of medication tremendously helps. Jen has been absolutely amazing in her office and really skilled in her ability to help us get people qualified for medication. So if there's an issue, just reach out to us. We'll do whatever we can to help. We'll fight whatever needs to be done. I'm sorry, I'm taking up question space. Anyone have any questions?
Yes.
Go ahead.
Okay. This is more for Vickie. My wife is a retired teacher, so her Medicare is part of the Blue Cross Blue Shield, the Medicare Plus Blue Group PPO.
Right.
Is what we saw today pertinent? And sort of, or is the Medicare somehow integrated with Blue Cross Blue Shield that would make it a little different program for us?
She has a very different program. When people come who are part of the Michigan School Employees Retirement System,
Yeah.
those are kind of stellar benefits. And you would not see her plans in this system whatsoever, nor would we encourage someone to leave that system. So,
No.
Go ahead.
Are we, is there, so you're saying that the information is what we saw today is different from what she would experience then?
That is correct.
Okay.
That is correct. Yep.
Right, thank you.
Would there be any?
They
Would
are
there be-
integrated.
Would there be any programs that would help to enhance their program that's already excellent?
Not that I'm aware of. They're out there, and I hate to be hesitant about anything here because with all the years and experience, and I'm very familiar with MAPSers, and they have dental, they have vision, they have drugs, they have some extras. It's a pretty good program. My fear for them, and don't tell this to your wife, but my fear for them is someday the tax system won't be able to support the burden because no employer, public or private, has done a good job of funding these commitments, and that commitment is funded through the taxpayer base as well. So no reason to worry now, but 10, 15, 20 years from now, it'll be interesting to see if they can keep it up. So I don't, but it's a great program, and we do not encourage people to leave. Some districts have done some stuff to it, so I will not say never, but they've got huge deductibles. I saw someone who had a copay of $300 or a premium of $300 a month. Then we begin to step in and say, well, let's see if we can help you out there. But that's our job.
Thank you.
Good question.
I just want to say thank you. I don't know if can you hear me?
Yes.
This is Chris. Okay, I want to say thank you because this has been very informative. And thank you, Dr. Calado, once again, because you're really helping us all out. And just this week, I was a victim of fraud, not through Medicare, but it is a horrific experience.
I'm sorry for that.
Sorry. Yeah, sorry to hear that.
To be really careful.
I do want to make mention about fraud. So I have been receiving phone calls where, it's one of those robots you answer, and then they say, well, your doctor's contacted us so that we can contact you about some medical equipment, whether it's a glucometer or it's something related to back pain. I have not done any of that. So if you're hearing stuff like that, know that I'm not sending people to call you on that. I actually announced to them that I'm the physician, and they hung up on me. So just be careful of that, okay?
Rightfully so.
You're not going to be solicited things from our office other than there's mention of we have a webinar that's going on or some event that's going on. But to have you go and pick up some medical equipment, we're not going to be doing that. And I don't think any practice would be doing that. So just make sure that you all know that.
Let me add to that. Years ago, referring to their doctor is involved is kind of new, but this medical equipment stuff has been going on for ages, and it's all, oh, it's covered, it's covered, it's covered, and a lot of it isn't. And people are we really discourage the whole DME, durable medical equipment stuff from going on. Another scam, if I can real quickly, and it's the hot one of the moment, is that, oh, hello, I need to get some of your information because we're reissuing plastic cards now. So I need to confirm your Medicare number.
Oh, my goodness.
Click. And I can't tell you how many of the Medicare loves our plan calls I get. I won't go into it, but it's excellent. And I had not heard they were referring to your doctor. I've always said, well, how do you know I have a back problem? How do you know I need that piece of equipment? So pretty much stops it.
Other question?
I have a question. I'll be eligible for Medicare next year. And I'm already receiving a lot of mailings telling me to call now and, check this one out, check that out. Do I just go to Medicare.org when my birthday is approaching to decide what plan I want to do?
Well, there's a couple of things involved with that. First of all, everyone should know that, let's presume your birthday month is June. You can enroll 3 months before or 3 months after, plus the month of your birthday. So you have a 7-month window that you're operating in. I'd be tossing mail like crazy right now. And when it's time to enroll, that is actually done through the My Social Security site. So they let you into the program, and then everything thereafter goes to Medicare.com. So you're going to start there. And this is a time when, if you want, once you start to get into it and you go, I'd like to talk to somebody or whatever, I need to understand this a little better. I'm open to having that conversation and helping you through that, or Matt is always available to help you through that. because once you get into it, because when you start to look for your GAP program, that's where you could get some good help
got me this
in looking at
tier
that.
exception for my
All right.
Repatha, and I
Thank you,
can
Vicki,
pay
and thanks for all the
$1,000.
information.
Okay, all right.
Thank you.
I got a couple free ones.
I think she's probably trying to say to you is that right now you're being inundated with a whole bunch of information that's really going to be changing pretty quick. So if you're not really due to end up making a decision 9 months from now, 12 months from now, it's probably better to wait until all the changes come along, especially now with maybe things might even change again because we have a new president that's coming along and the changes that might come along with insurances. So I would say that probably ease your mind and not get caught up in reading all that stuff right now. And then it's been wonderful that Vicki has been able to go and meet with people individually. You know, she's either meeting with them or talking with them on phone just to help guide them to what needs to be done to try to pick out the better plan. The other part I want to bring up is that when you looked at the price of everything and the medicines created a big cost in what the person's yearly fee would be predicted or estimated. I think everyone also has to keep in mind that if you are going to end up being hospitalized frequently, you're going to have to add those costs into the Advantage plan as additional costs. So yeah, it might seem like a savings, but if you end up getting hospitalized twice, you might end up with a $3,200 extra hit onto your total cost for the year. So it might still look attractive on another side of it that might be a little bit more expensive, just keeping in mind that there might be a chance you might end up having a hospitalization or 2 or 3 hit added to that. But keep that in mind.
And I guess one of the things that's always good when, you know, having worked in the world of risk and loss and that for years, the reason that we go get insurance in this is because the greater the degree of the loss, i.e. the risk to you, the more you need the coverage. So I'm going to turn that into the live example of, I might get a free office visit, but if I have that big deductible, which is more risk to me? And that's where you need to place your coverage. That's where you want to put your dollar of protection. So it's another way of looking at that. The bigger the risk and that hospitalization, hey, I've been healthy all my life. I've never had one. Guess what? You just jinxed it. I'm teasing a little bit. I'm sorry. I apologize, but it's going to happen someday, and you cannot plan for that. So we purchase our insurance for the unplanned larger losses, and a hospitalization on a Medicare Advantage plan would be one of those. You'd have to be aware of. I keep looking up because you're on the screen for me. I'm not sure it's my good side. Other questions?
Other questions? Well, thank you, everyone. If anyone has any questions, please reach out to Vicki or to our office, and we can link you over to Vicki to help out. Okay. I guess I'm going to say one last thing. You know, this is when it wasn't intended for this, but since I have a number of people here that could listen to this, I just want everyone to be very careful because the COVID issue is really, really running rampant. Our hospitalization has tremendously went up, and we've had, unfortunately, some individuals who had to be hospitalized for now further treatment because of their conditions have declined significantly. So do what you can to prevent infecting each other. You know, wash your hands, social distance, masks. You know, keep your gatherings to a lower amount if you are going to gather with people. And then just reach out to us. We have a laboratory study, a laboratory that we're linked with now, so that in the event someone gets exposed, we can reach out to them and they can actually go to your home, swab you, and that we can end up having the results in within 24 to 36 hours. That will keep you from having to go to a urgent care or emergency room, and actually people are scrambling just to get their testing through there, and it's actually taking about 5 days for their tests to come back. And that's a long 5 days to sit there and wait, whether you're positive or negative. You'd still have to be in quarantine anyway, but it's nice to be able to get that result quicker. So if you guys have any questions, if you guys are running into problems, just reach out to our office. We'll do the best we can to help through this craziness. All right, any other questions before we move along, and everyone have a great rest of the weekend?
Can I ask one more?
Sure.
They announced yesterday that their vaccines should be out in the next few weeks. How quickly do you see getting that?
So Beaumont's really working hard to try to get hold of the vaccine, so I'm sure they're going to end up getting a lot. The pharmacy in our building is on track to end up getting their vaccination so that they will be able to help. We'll be also looking through MDVIP and through the pharmacy downstairs or any other services. I think all of you know that our practice moves pretty quick. We are probably much more cutting edge and proactive, so we'll probably hopefully end up having that pretty quick. And we'll see based on the guidelines on people who should get it. We'll try to get it out to them. Obviously, the big push that they've been emphasizing is to the healthcare workers who are exposed, and then those people who are at risk who have pre-existing conditions, which really puts a lot of who I care for in that category. So as soon as we get that information, we'll be passing that along to everybody.
Thank you.
But I definitely would encourage people to get it. And I think those who've heard my lecture, and there's 3 front runners. You have the one that's AstraZeneca, the other one's by Pfizer, and the other one's Moderna. The one by Pfizer and Moderna are the ones that are the novel way of making vaccine that's likely to be used to make other types of medications because of its really unique ability to focus on what to take care of. But those medications, those 2, I would strongly encourage once those come out. All right.
Thank you, Doctor.
Dr. Calado?
Yes.
Dr. Calado, we just saw a news report on Fox today that was saying that the biggest part of the problem with the vaccine will be that the majority of people will not take it because they're afraid of the long-term effects somewhere years, from when you take it or whatever, having any issues, especially younger people. I know my grandchildren, they're like, no, we're not going to take it. So the gentleman who was on this morning said, oh, people be prepared that when the injection comes out, and I don't know why he would do this, but he said it's very painful. You might be sick for a day with a high fever, and then that will discourage people from coming back for the next injection, and then the first injection won't count for anything. That's the first time I've ever heard this and all the things that they've had on about.
Well,
Had you heard that?
Yeah, yes, I have. And I think it's important for people to understand it's not a painless thing to go through. And it's not like you're not going to have symptoms, just like when you get the flu vaccine, or you're going to get tetanus, or you're going to get pneumonia vaccine, or you're going to get the MMR booster. You're going to end up having, or you're going to feel wiped out. You might feel nauseous on it. And you may sleep the whole day after that. But the bottom line is you want to try to protect yourself from death. And right now, the immediate threat right now is if you get the COVID, now you're fighting the chance that could you die or not die. Granted, there's a small percentage now of people who are dying now from the disease, but we also do have people who are now having long-term complications from having the COVID infection. So you have to balance what you're looking at in terms of long-term problems? Are you looking at long-term problems that could happen on the vaccine, or long-term problems that can happen if you get the COVID, or worse yet, that you didn't survive and you actually passed from it? So
Yes.
it will be an individual decision for everybody. But when you look at what's our goal? Our goal is to be able to get our life back on track so that we can all be the way we were similar to before. We can spend close quarters with each other. We can go to restaurants. We can go to functions. We can hug our family member. We can hold our hand, and we could be with somebody that's really important to us. We can visit our loved one in an extended care facility or in the rehab center because it's not locked down. I mean, so what is the trade-off? And
Yes.
so obviously we don't want anything that's really bad that's going to hurt somebody. But when you're talking about a medicine that's completely made in a different way, that it's not a live virus, was never live in the first place, that's only a certain portion of that part of the virus that was present there, and that your body is actually making that in your body and now presenting or making the antibodies to recognize that, so that if it comes into your body, that it will attack it. That's what we want. We don't want, and the traditional way, which really is the AstraZeneca way, is taking the virus, weakening it, and then introducing that weak virus into your body. So that is the traditional way of making vaccines. Whether that's completely the great way or good way, I would say that, you know me, I'm much more progressive, and I'm looking at here as something that's more cutting edge in the way they're making vaccines, that I would think that because of that, and it's more specific and it's not a live virus, it's less likely to make us ill.
So will that vaccine, though, will just protect the people who are taking the vaccine? And the gentleman said it was like 80%. So does that mean that other people around you who refuse to take the vaccine, you're not afraid to be around them or not because you had it? Because he said you'd still be masking up for quite a while even after taking the vaccine.
But I think all of you have heard me before. For those individuals, this goes for all vaccines. So if you don't take the vaccine, then you're the type of individual who is going to be at risk to get infected, versus the person versus the person who took the vaccine is less likely. I still think that those people who take the vaccine should still do the right things in terms of prevention, so that they don't go and infect other people because, you know, they ended up coming in contact with the material, didn't wash their hand, and then they went to go and feed a loved one by hand, and then they introduced the virus into that person, or for whatever way it's going to get transmitted. But that person who is vaccinated is less likely to get infected, and likely less likely to pass the infection to somebody else.
Okay.
So they're going to end up having much more ease of mind about what's going on than an individual who hasn't had the vaccine and essentially has to spend their time kind of looking over their shoulder whether they're going to be confronted with an infection. So
Right.
that's the way I look at it.
Okay. One last thing, very quick. You mentioned to me that I should get the series of 2 shingles shots, and the pharmacy downstairs was just excellent with all their information about it, and it was actually 0 copay. But is it safe to get that now with the high rise in this COVID? Does that interfere with that? Because it said you might get a slight fever, you might get a slight cough and all this and that. Then if you got the shingle shot and then you got the reaction to the shingle shot, would you be concerned, gee, I wonder if this is the COVID or not, or it's from the shingle shot?
Well, I mean, everything is based on the temporal arrangement, right? You just received an injection, you had a little low-grade fever from it, so it's probably related that it's from the vaccination.
Okay.
Shingrix is a type of vaccination that also is never alive. It was actually part of a component of the virus that's now introduced to you that you make your immunity based on that. So it should not create an infection. It's just creating your body's reaction to something foreign in your body that's developing. So I still believe that people should get the shingles shot through this time, because stress is one of the things that can bring out the shingles in people.
Mhm.
And this is obviously a very stressful time for all of us. So prevention is a big key. And shingles, most people can handle it, but it can be quite painful. And the really devastating one is the one that comes across the face, and it can actually affect the eye and cause a person to go blind. And in really severe forms, it can cause a type of bad pneumonia that is not good. So, I mean, you want to really be in prevention mode and put yourself in that you don't get it. So I think you should get it at this time, especially when it was going through a time when it was very difficult to obtain because everybody wanted it and it was flying off the shelves. And I think many of you knew that it was very difficult to get a hold of. So I think it's a good time to get it now.
Well, I'll give a plug to your pharmacy downstairs because we had checked other places, Walmart and Walgreens, and they were charging anywhere from $150 to $175, and your pharmacy downstairs had zero copay on it, however they were processing it.
Yes, they've been very good. He's been very good about trying to find discounts for medications for people. I mean,
Right.
and that's why I said that you might look at that number in terms of when you go to My Medicare and see that total cost that's going on, but there are ways that we can still whittle away at it to get it down lower and lower and lower to help out.
Okay. And does somebody who gets a shingle shot, do you have to know whether you've ever had chickenpox as a child or not? Is that a factor in getting a shingle shot?
The answer is yes, and that's why in those individuals who have not had chickenpox before, then we'll get a varicella titer on them to see if they've been exposed, but they just never developed the infection.
Okay.
So if their levels are elevated, then they should be able to have the shingles vaccine without any issues. If they haven't, then we'd have to just watch them to make sure that they didn't start to develop chickenpox. And chickenpox, when you get in adulthood, is a lot more severe than when you get it when you're in your younger years. So
Right.
that's that we'd have to go and figure out whether we want to take that risk or not.
Okay. Thank you so much. That clears up a lot for me.
All right.
Great webinar again between you and Vickie both.
Any other questions? Thank you so much. Any other questions? I just want to thank you all. A lot of this would not be possible without all of you being members and understanding that this is what we do, and it's changed the landscape of taking care of people. And I just want to thank Vickie again for her kind assistance in doing this for years to take care of our members and other people, help us navigate and understand Medicare better. I would tell you that being a physician, had no idea about it other than just this is something in the older population, and that I didn't want to even think about it. But it's important, and it's people like Vickie who really put this in better perspective for us, so that it's not that we want to shy away from it. We want to learn more about it so we have a better understanding of it. So thank you so much, Vickie.
And I am out here year round for your patients, Dr. Calado. If anybody feels that they're not hearing from me, I don't want to have you bother the office, but a quick tick to me is never a problem. I'm always willing to help.
I know.
So.
You never like the notoriety or the
no, just want to help.
Thank you.
Thank you. Well, and I'm glad to be able, in this season of COVID, I'm glad to be able to talk to a lot of people at once, because everybody's one-on-one and repeating. But thank you all for being part of today, taking your time today too.
Yes, thank you. Everyone take care. Have a great weekend. If there's any questions and anything we could do, just let us know. Okay?
Bye, Bernadette.
Bye, all.
I'm signing off.